Paul Reese is a 22-year-old carpenter who fell from a roof this morning. He sustained a fractured pelvis and ruptured spleen. He underwent an emergency splenectomy and returned from the recovery room 1 hour ago. Ralph Dennison is a 68-year-old man who has a 2-week history of malaise, fatigue, and a 10-pound weight loss. Until recently, his diabetes had been controlled with oral hypoglycemic agents. Over the last few months, however, he has required insulin to control his blood sugar.
Patrick Bedard, the store driver. Thanks for coming by. Now it's 9 minutes before the hour. In our next hour, we'll hear about 2 South Africas, growing up blacks and growing up white.
Business travelers are waking up to the good deal they get at Howard Johnson. A recent survey was positively eye-opening. Our guests rated our message and wake-up service higher than Best Western guests rated theirs. Our room decor better than Holiday Inn guests.
Well, Hollywood's latest action film involves a very famous director, Michael Cimino. You may remember him because he had a hard time with his disastrous 1980 film called Heaven's Gate. So everyone wondered whether his new production, Year of the Dragon, would be a triumph or just a fire-breathing monster. Pat Collins is...
Mrs. Brooks is a 71-year-old woman who was admitted 2 days ago after a syncopal episode at home. She has numerous medical problems, including hypertension, renal failure, congestive heart failure, and diabetes. Some of her medications include insulin, digoxin, Lasix, Minipress, and nitrates. Although she is very conscientious about her medications, she takes so many that she needs help from her daughter to select the day's medications. While her daughter's been on vacation, it has been difficult for Emma, and she admits to becoming a little confused about her medication schedule.
The biggest ever on this continent. The winning numbers were drawn last night, and we should know later this morning whether that winning ticket was sold. The numbers: 14, 17, 22, 23, 30, 47. And that's our news to the top of the hour. Kathy? Thanks, Kathleen. 8 minutes after 7, Dave Murray has the weather for us. Hi, Dave.
Now some big storms starting to pop in the plain.
Everything looks so fuzzy to me. So blurry. Did they put a yellow bulb in that light over there?
Frank Perry is a 42-year-old man who had to retire from the police department when he was diagnosed 1.5 years ago with multiple myeloma. He has been admitted this time for a course of chemotherapy. In recent months, he has not been responding well to his chemotherapy and has required increasing doses.
Rose DeLuca had a colectomy 6 days ago. Her post-operative course thus far has been uncomplicated, and she is looking forward to going home today or tomorrow.
Oh, my stitches hurt more today than yesterday. Oh, that really hurts today.
Frank Perry is a 42-year-old man with a history of multiple myeloma, which is being treated with Cytoxan, BCNU, and vincristine. His last chemotherapy treatment was 2 weeks ago, and he is admitted now with intractable pain, headaches, and a neurological deficit.
Loves to wear cotton. With its crisp, natural crease, it looks and feels great. When you want to look terrific, dress up in cotton. Feeling good and looking good, that's what cotton...
Acid work fast enough.
It seems to take forever.
Does your antacid last long enough?
No, I've got to take it again.
Maybe your antacid isn't strong enough. Try new double-strength Mylanta 2. Mylanta 2 has nearly double the antacid medicine, nearly double the anti-gas medicine, nearly double the acid neutralizing power.
Ruth Green is a 65-year-old woman who was admitted yesterday to the CCU for chest pain. A myocardial infarction was ruled out, and she was transferred today for GI workup. She has a history of rheumatic heart disease, and despite her physician's recommendation, has resisted mitral valve replacement. Her medications at home include digoxin, Lasix, and nitrates. Since admission, she has been pain-free.
Gee, this is fantastic. I wish I had a bed like this at home. Then I wouldn't have to sleep on 3 pillows.
Hello, Mrs. Green. Would you lean forward, please?
Stanley Abrams is a 72-year-old man who was admitted 2 days ago after a fall at the nursing home. His injuries included a fractured humerus and 2 fractured ribs. He also had a brief period of loss of consciousness and was admitted for observation. His other medical problems include diabetes and hypertension.
Is too tough to crack.
Hi, Mr. Abrams. Can you lean forward, please?
Marion Firth is a 42-year-old female admitted yesterday to the oncology unit for pain management related to her diagnosis of metastatic breast disease. Although she has significant rib, chest, and back pain, she has been able to care for her family. Marion will be discharged home when pain is managed with a PCA pump.
I feel so weak today.
Maybe I should drink some water. That might help me go to the bathroom. Wish I could get comfortable I'm not sure this machine is giving me enough medication.
Nice job you boys did on us on the highway. I thought I might just return the compliment.
Ooh, we're tired. We gotta go to sleep. Maybe I should go to the bathroom first. My legs feel funny.
When an old Chevy drives up and a man gets out. He's got a gun. He makes Ken tie me up, and then he takes him.
What's wrong with my legs?
Mary Wagner, a 37-year-old female, has been admitted to the oncology unit for a 4th course of chemotherapy. She was diagnosed with cervical cancer 2 years ago. She had a radical hysterectomy, internal and external radiation therapy, and recent placement of nephrostomy tubes to relieve obstruction of ureters by tumor mass.
Oh, I wish I could get comfortable. These beds are so hard. Oh, I just can't get comfortable.
Stephen Slater is a 42-year-old bisexual male who is HIV seropositive and became symptomatic of AIDS 6 months ago. He was just admitted to the medical floor after being discharged 3 days ago when he was started on a protocol of AZT. Mr. Slater was brought in by his 20-year-old son David because his wife had become overwhelmed by the numerous hospital admissions her husband has had in the last 6 months. After attempting to manage his anorexia and bowel incontinence at home, David admits that it took much encouragement, if not force, to get his father to come to the hospital.
I can't take it anymore. Why did David bring me here? I want to go home. I want to go home. I told them I didn't want any of this. I just want to go home.
Mary Grasso, 45, married with a 12-year-old daughter and a 10-year-old son, is 2 months post-left mastectomy. Positive nodes were found at the time of surgery. Mrs. Grasso was also found to have positive liver and lung nodules. She has completed courses of both chemotherapy and radiation therapy. This visit is for evaluation of reoccurring pain. The nurse has been shown to Mrs. Grasso's bedroom by her 12-year-old daughter.
Hello, Mrs. Grasso. I'm Madeline Crowder. Do you remember me?
Yes, I do. Thanks for coming. Won't you sit down? Just put those anywhere.
Now, tell me how you're doing.
Not very well. I'm just so tired. I start something and then I can't finish. You know, I mean, like making the bed, putting away the laundry.
I also understand you've been in some pain.
Yes, I was doing pretty well right after the radiation, but now I just seem to be in pain almost all the time.
Tell me about it. Describe it for me, where it is, how it feels.
It's dull most of the time. It's in my lower back and sometimes down my legs. It seems to be worse when I'm standing or walking. It gets like a knife, and it just really scares me sometimes.
Are you taking anything for the pain?
Well, I've got some of those Percocet that the doctor gave me. They help a little bit, but I don't like to take them. They make me nauseated. Yes. Can I have a snack? But don't eat too much. Your dad's taking you out.
Do the children help out?
Oh, they try. But they have their own lives to lead. And they don't like to see me sick. I mean, they don't say anything, but I can tell. They kind of avoid me sometimes.
Tell me more about how you're feeling. Any other physical problems?
Well, I seem to be having trouble urinating. Maybe it's because I'm not drinking a lot. I just don't feel like it.
You know, Mrs. Grasso, you look very uncomfortable right now. Would you feel better to lay down in the bed? I'll prop up your pillows for you.
Thanks. Oh, can I have one behind my...
Sure.
Thank you.
Now, are you having any trouble with your bowels?
I don't think so. I really don't pay much attention to it. The pain kind of distracts me from other things.
What about walking, lifting, driving? Any problems there?
I don't drive much lately. It's such an effort to go out. Lifting doesn't seem to be a problem. My daughter's putting away the groceries. Walking, well, I get unsteady on my feet sometimes. It's sometimes like I can't feel the soles of my feet. Do you think that's the chemo?
I'm not sure. There's so many side effects from chemo and radiation therapy. When's your next appointment with your doctor?
It's not for another month, nurse. I know I'm not going to get any better,
But I'm just so afraid of the pain. My children. What's going to happen to my children?